Hi, my name is Colin Ryan, and this is Augusta Medical Hospital's Cybersecurity Policy and Executive Summary. Augusta Medical's organizational efforts include improving our overall security posture, protecting our patients' medical data, supporting our 22 doctors with their patient care, and supporting our 10,000 patients. Our business needs include implementation of the NIST cybersecurity framework, systems upgrade, patients' ability to view their medical records, systems that can support all digital medical imaging requirements from our radiology department, and employee training and awareness. Now let's take a quick look at the overview of what I will be discussing in this presentation. So I'll talk about the process for creation and changes to different types of standards, the NIST cybersecurity framework and life cycle, our security policy, our systems network and systems diagram, risk assessment, business impact analysis, and our business continuity plan, standard laws, regulations, policies, voluntary and framework-based standards, incident response and incident handling plans, cybersecurity awareness infographic, and executive summary. So let's take a look at how standards are created or changed. So creating and changing standards really depends on the type of standards and the specific requirement of the standards. But in general, we're going to start with identification. You want to identify a need for a new standard to address a new technology, or a need to update an existing standard to keep up with changing technologies, or a need to address a specific problem or issue. Then we'll move on to the next step, which is committee. This is finalize the proposal and then establish a committee of experts relevant in the field. Once a committee has been established, we can develop the draft. And this is going to require study and preparation to develop this draft, and then review the draft with the committee and members to make sure it's approved for public review. Then we move on to public review, which is making the draft available for the public to review, and they can offer feedback that's used to improve the quality and the standards. Once that's been done, now we move on to approval and publication. This is finalizing the draft after reviews, and then we can publish the standard. Now, throughout all these steps, we always need to remember maintenance and revision. So standards need to be updated and revised regularly to keep up with the changing technologies and emerging issues. The process of creating and changing standards is an ongoing one, and requires regular reviews and updates as needed. Augusta Medical Hospital is aligning itself with the NIST cybersecurity framework. And what this is guidelines and best practices to improve our cybersecurity posture. And why is this beneficial to us? Well, it's flexible, it's no cost to implement. It has 5 core functions, and this will help us with our regulatory and legal compliance. So these 5 core functions: identify, protect, detect, respond, and recover. So for identify, what processes and assets need protection? Then once we identify those, we move to protect, which is safeguards to ensure these assets are protected. Then detect is mechanisms to detect when the incident occurs. Respond is techniques to contain the event and how to respond to it. And recover is just restoring capabilities and services back to the way they were. So if we look at Augusta Medical Hospital, we've been the victim of a cybersecurity incident over the last 2 years, some involving ransomware. So right now we stand at a Tier 3 repeatable offense for our NIST framework. So what are some methodologies we can use to establish our cybersecurity program? Well, we can do risk assessment, have a security policy in place, implement technical controls, constant monitoring and reviewing, employee training, and have a well thought out incident response plan. Augusta Medical Hospital's security policy documents our rules and expectations to protect and maintain our organization's confidentiality, integrity, and availability of our data. And really, this is our overall goal. And through our security policy, we're going to accomplish this by implementing physical controls, having administrative security, implementing a social media policy, having set procedures for employee onboarding and offboarding, implementing a mobile device policy, having technical controls as well, and dealing with insider threats. And all this goes more into explanation with our security policy document, but this is just a quick overview. Now we're going to take a quick look at how data flows in the diagram. So it's important to understand how data is traveling throughout your organization. As we can see here, we kind of list where this data is going, who's it's traveling to, and the pathways. This kind of gives us an idea how our data is flowing. And then below it, we have listed our user authentication protocols. So this is someone attempting to log into the system and what's going to happen to authenticate and make sure they have authorization to access this. Next, we're going to take a look at our network diagram and some of the security measures put in place to help authenticate and keep our data safe. So, internet coming in, we have an external firewall and an internal. In between that, we have our intrusion detection system and intrusion prevention system. So this is really our front line trying to stop anything from getting to our servers. Coming off that switch though, we have a demilitarized zone that includes our web server, mail server, and our voice server as well. And then if you follow it down through the internal, you can get to our critical servers that are backed up. And throughout all this, we want to make sure that authorized users using a VPN, as well as our patient portal, can still have access to parts of this network. Let's take a look at risk assessment now. Augusta Medical Hospital recently performed a qualitative risk assessment. We are able to accomplish this by identifying the risks, then assessing the likelihood and impact of those risks. We then prioritize the risks and how they affect our business operations and critical needs. We then discussed ways to mitigate these risks, and then we review consistently to see if any updates or changes are needed. This is just a quick overview of our risk assessment. More is listed in our documented policy, but our quick discovery was our EHR systems have a high likelihood of ransomware to occur, as well as a high impact to our organization. This is due to our past 2 years of ransomware attacks. And then also our outdated medical devices have a high likelihood and severity of potential risk. Augusta Medical's Business Impact Analysis and Business Continuity Plan. Our business impact analysis is used to determine and evaluate the impact if one of our operations were to be interrupted. This is an essential component to our business continuity plan. And our business continuity plan really just documents how our operations will continue during unplanned disruption. And this business continuity plan should not only include the business impact analysis, but we also need to look at emergency response protocols, incident response, disaster recovery, have a contingency plan, and as well test and maintenance this plan as well. It's going to need reviews and updates regularly with the constantly changing environment. Augusta Medical Hospital will uphold standards, laws, and regulations, and these include but are not limited to the Health Insurance Portability and Accountability Act, HIPAA, the Health Information Technology for Economic and Clinical Health Act, HITECH, Payment Card Industry Data Security Standard, PCI DSS, and then Quality System Regulation. Now we're going to just take a quick look at the impact of these standard laws and regulations. Well, by following and maintaining these, we're going to maintain our confidentiality, integrity, and availability, and that is one of our main business objectives. This will also ensure patient health and information is protected. It will help our reputation, and then we're going to avoid unnecessary fines and penalties. Our incident response plan provides our organization with a structure for implementing and executing a quick and efficient response to an incident. Our response plan follows the NIST response principles, which is preparation. This is compiling a list of IT assets. Then detection and analysis. This is identifying precursors and indications of an attack. Also identifying a baseline or normal activity and how events are deviating from it. Once this has been detected and analyzed, we move on to containment, which this is stopping the attack. And once this attack is stopped and contained, eradication is the process of removing all elements of the incident from the environment. And then we can move on to recovery, which is restoring our systems and operations back to normal. And finally, we have post-incident activity, which this is investigating the incident and learning from what happened and improving on our future processes. In addition, our incident response goes over our communication guidelines, our standards for contractors or third parties, our incident response team structure, and training. Augusta Medical Hospital has created this cybersecurity infographic to help people understand the risk implications of internet use. This includes using mobile devices, Internet of Things, and intellectual property. Also, we discuss OWASP top 10 web application security risks, and then developing and implementing security for web applications. And this is methods such as conducting risk assessments, implementing secure developmental practices, web application firewalls, conducting regular security tests, ensuring employees are trained, and keeping software up to date. Finally, let's go over our executive summary. Our mission at Augusta Medical Hospital is to provide exceptional teaching, research, and clinical care environment. The health of our patients will be our top priority, and we will uphold the highest standards and ethics the healthcare industry can offer. Augusta Medical is located in Augusta, Georgia, and strives to be a leading medical facility known for our commitment to healthcare, innovation, and creativity. Guided by our core values of collegiality, compassion, excellence, inclusivity, integrity, and leadership, we strive to make a positive impact in our community and the world. This is a quick list of my references, and thank you for listening to my presentation.